Every time a new technology lands in healthcare, the first reaction is usually skepticism. Will it really save time, or will it just add another step to an already overburdened workflow? Well, here at the Oracle Health Summit, Hudson Physicians showed what's possible when AI isn't just bolted on, but actually embedded it into the EHR and incorporated it into the daily workflows. For their physicians, it's about reducing overall pajama time and capturing more accurate notes and actually improving the follow-up for patients. All of those things were achieved with the help of Oracle's clinical AI agent. I sat down with Dr. Ryan McFarland, physician and board member at Hudson Physicians. I wanted to find out more about how they became believers in this AI scribe. Let's get to it. Dr. McFarland, welcome to the program.
Thank you. Thanks for having me.
I'm excited to be with you here at the Oracle Health Summit here in lovely Florida. And I'm going to really be excited to ask you some questions about the new AI agent that you've implemented. But before we get there, Doctor, could you tell us a little bit more about Hudson's Physicians?
Yeah, Hudson Physicians, we're a private practice group, primarily primary care, but multi-specialty with several specialties. We've got about 60 providers serving our community right in the River Valley on the border of Minnesota and Wisconsin. And I've been with Hudson Physicians since 2019, and I'm currently on our board of directors right now.
And what kind of care do you guys provide to your catchment area?
Yeah, so we are full spectrum primary care. We've got OBGYNs on staff, sports medicine, podiatry, pediatrics, sleep medicine. We have an imaging center on site, urgent care on site. We've got an ambulatory surgery center on site, and then we've partnered with multiple other private practice specialty groups also on site. So we've created a nice little medical center to be able to service all of our community's needs.
That's quite a diverse set of specialties and services that you provide.
It is.
What's that like in terms of corralling all the different types of physicians that you work with?
Lots of different personalities, physicians' goals. It's a challenge, but it's a lot of fun. We're all very driven towards the same goal of remaining independent and caring for patients first, and so that kind of helps keep all those different interests aligned.
Now, Dr. McFarland, I don't think it'll come as a surprise, but whenever we implement new technologies in healthcare, to me, it always seems that it's met with skepticism, right? I think we're very evidence-based, right? So we're very distrusting maybe of technology at the start. Was that the case when you implemented the clinical AI agent from Oracle Health?
I would say a little bit, but it was very short-lived.
Okay.
So a good example is we had a older doc, he's semi-retired, just working 1 to 2 days a month. And when we implemented, he's like, I'm not gonna use that. I've been a doc for 40 years. I'm just gonna keep writing my note. And one of our team members said, here, just try it. Download it on his phone for him. And he looked at it and he goes, well, what do I do? She's like, hit the record button. Hit the record button, went in the visit, came back out, and he's like, now what do I do? She's like, hit the end button. And he's like, okay. And then, within a minute or two, the note came back. He's reviewing the note, and he stops and goes, well, this is the best note I've written in 40 years. And that was the end of his resistance to using the product. And it's been implemented widely within our group.
So why do you think that was? So first of all, that's a great story.
Yeah.
So why do you think that this technology, because we've heard this, by the way, we've heard this story over and over again, but why do you think docs have been so positive on this type of AI technology?
So it's a huge burden taken off of our workflow. We're paid to think critically, take care of patients. I'm not a scribe, like I shouldn't. It's not a good use of our time. And now we have this utility, this device that can accurately record the entire visit, capture things, and write a better note than many of us do. And I would say, that's some of the hesitancy with some docs. They like the control, they know what they're writing, but then quickly using the AI, that fear is gone.
So really, is it more of the efficiency play and the fact that with this AI, the scribing and how it automates that they're taking a huge burden off the docs?
Yeah, it's efficiency, decreasing that pajama time. You're not, trying to get notes done after hours. You can keep taking care of the patients, and the notes aren't really hanging over your head like they used to. And then the other thing we know, especially from a lot of colleagues who maybe didn't write the best notes, we now are getting much better notes and information. So when I'm following up a colleague's patients who maybe didn't write the best notes before, I now know what's going on. So it's I think overall an improvement for across the board.
In your experience now, having rolled this out, were there any pleasant surprises in addition to the efficiency gains that you noticed after implementing Oracle Health's clinical agent?
You know, personally, being one of the first adopters, beta testing it. I mean, seeing from where it came from to where it is now, it's a wonderful to see where it's come and how accurate and faithfully it is documenting. A couple nice surprises. I'll finish a pretty complex visit, addressing maybe 15 to 20 problems, and I'll have missed putting in a problem. The AI agent didn't. So I get my note back, and all of a sudden there's like 2 problems that are important to the visit that are documented and faithfully captured with the plan of what I was doing. I was like, oh yeah, I need to add that and make sure that and follow through with it. So I'd say that's some of the pleasant surprises. It doesn't get tired. It doesn't forget. It's all there.
I do appreciate that you said that it doesn't forget, right? Because we're human, so you have a very long conversation, like you said, full 20 minutes, you're actively listening, and so sometimes things could get lost. But with that AI agent in the ambient listening, in the background, you're saying it captures some things that maybe at the moment slipped your mind.
Exactly. It's
amazing.
A huge saver.
So I got to ask this question. Where next? Where are you looking forward to applying more AI now that you've got a taste for it?
Fortunately, I'm heavily involved with beta testing some of their more products. So we're beta testing their orders entry. So the AI agent, while listening to us, is proposing my medications, my labs, my imaging orders, referrals, return to clinic, all proposing that for me. And then also professional fees, where it's recommending levels of service and putting that in for me as well. And then the new EHR, the AI-enabled EHR is, it's the icing on the cake. That's really what we're waiting for, because that really encompasses all the products we've already talked about and really makes it work well together. But it's more efficient. And again, I'm not forgetting to put in that CT I talked about. I'm not forgetting to order their colonoscopy just because I didn't click the button while I was in the visit. It's getting done. Again, the AI doesn't get tired. It doesn't forget. It's proposing those things for me.
When you're looking at these new technologies and the ones that you're beta testing or maybe collaborating with Oracle on, what in your mind are you using as criteria as to whether this is a good technology or whether maybe it might need a little further refinement?
So I would say first and foremost, is this improving patient care? Again, if I'm not delaying care because I forgot to put an order, patients aren't calling back, things like that. So is it improving patient care is number 1. Number 2 is it improving the workflow of the physician? Is it making that better? I would say those are probably the 2 most important things off the bat. And then, third, as a business owner on our board, there's the fiduciary responsibility. Can we make this profitable? Is it a return on investment? And as we continue to look at this feedback, I would say it's a yes to all of those. And when I'm giving feedback, that's where the feedback is surrounded. Here's the issues where it's maybe not improving patient care. Here's what you have to make a change to get to that point. Here's where it's not as efficient. Here's the changes I would recommend to make it more efficient. And the engineers and their team leads are listening and changing that feedback actively as we go through the beta products. And it's been a ton of fun.
Putting Oracle aside for 1 minute and talking more in general about IT vendors in the healthcare space, why is it so important that vendors collaborate closely with clinicians like yourself to develop their products?
So I would say a good example. So early on when we were first doing the AI agent, so we were giving them feedback and they're like, this isn't fast enough. We're having issues with this. This needs to work different. And they weren't quite understanding. They were like, well, it's a quick turnaround time. It's not that bad. So they sent the engineers to the site to just watch us work. And that was a game changer for them and for us because they immediately, within 10 seconds, the engineers were like, oh, this isn't fast enough. Oh, that's how you're using it. And change the product so it's clinician forward, patient forward, rather than, engineers aren't doctors. They don't sit in the clinic. They don't understand the workflow. And Oracle realizes that. And, any of the third-party apps too, and partnering with physicians is hugely important to bridge that gap so that way the product works for the physicians rather than us working for the product.
So what works in the lab, in other words, may not work in real life until they see you in actual practice.
Yeah, and then it clicks quickly. They're smart people, and fortunately they've been able to solve those issues and have a wonderfully functioning product at this point.
Is there anything in general that you're excited to implement at your practice to further, whether Oracle or otherwise, to further enhance the care that you're providing?
Yeah, so there's quite a few things. We have quite a few. There's a lot on the horizon with Oracle stuff that's slated to come out that we're trying to partner with, and from a business standpoint, we can't always necessarily wait. Now we might switch to that product once it's available, but I would say some of the most exciting things for me are actually the patient-facing things. So the patient portal, having upgraded portal where patients have more access to the information and explanations of what tests were done and results that they can see up front. It's easier communication for me with patients when they can access that. The other thing is some of that smart scheduling where patients can easily access online and get appointments with me or one of my colleagues. So that's some of the really exciting things that I see coming forward is more of the patient-facing side. They're building the groundwork with the EHR and everything there, but also focusing on the patient side is really exciting.
Dr. McFarland, I have to ask this question too. Why did Hudson's Physician, in your opinion, stay with Oracle Health as their EHR vendor?
So, timing, right? So Oracle bought Cerner, I think it was 2019-ish. And right at the time we were contemplating, our contract was up, do we switch away from, at the time, Cerner? We're like, Oracle's buying, we're like, that could bring a lot of potential benefit for us. And everything else was kind of a lateral move, so we're gonna stick with it. And then lucky enough, got early involved. We were asked, hey, do we want to partner and help beta test and create these new products? And like I was always told, if you have a complaint about something, you better come with a solution or be part of the solution or just do something different. And this was an opportunity for us to be part of the solution with a lot of physician clinical complaints.
So just to recap, it was a lateral move at the time, so you decided to stay.
Stick with it.
And then it paid off because they decided to really collaborate with you to develop some of those new products.
And at this point, with how much we're involved, the feedback that we get to give, how much they listen to us, it's a huge benefit for us that we get to be part of this. But also, when we've looked at other vendors, other products, there's no one else in the electronic healthcare health record space that is doing anything similar to what Oracle is. Everything else is, they have AI implemented here or there, but it's more of a patchwork on top, whereas this is truly from the ground up and integrated and works seamlessly, which is super exciting, and to be part of it's pretty special.
So in addition to seeing that brand new AI built from the ground up EHR that Oracle is making available, what are some of the other exciting things that you're hoping to get out of being here at the summit?
So, just learning and getting more understanding of some of the parts that I'm not as directly involved with or I'm not aware of. And a lot of that is more of the business side, so the revenue cycle side, some of the prior auth side of it. Prior auth is a huge headache, working with insurance, what's covered, what's not, and listening to Seema's keynote speak this morning, hearing that investment from them is real exciting. So getting to see the advancement throughout the entire healthcare space, not just the patient side, not just the physician side, but the full suite of things. It's really exciting as a business owner to see that come through, and it will impact my physician. I have a full panel, full practice dealing with prior auths, what meds are covered is difficult, and to see that also being evaluated and cared about at this level is pretty exciting.
Dr. McFarland, last question for you. Where can people go to learn more about Hudson's Physicians?
Yep, so hudsonphysicians.com is an easy way to learn about us in Hudson, Wisconsin, and you can find providers there, find myself, all of my colleagues, and see all the full set of services we have to offer at our medical center.
Well, thank you so much for the information you shared, and thank you for coming on the program with me today.
Thanks for having me, appreciate it.
I really liked how Dr. McFarland and his team at Hudson's Physicians are embracing AI and how it has improved the quality of their patient notes. What really stood out was how quickly skepticism turned into advocacy once the doctors saw that clinical AI agent in action. And hey, be sure to check out the other interviews we did with Oracle's clients here at the Oracle Health Summit. The links are just below. And if you enjoyed this interview, please mash that like button and click subscribe so you can get more great interviews like this. I'm Colin Hung. Thanks for watching, and I'll catch you on the next video.